Kathy, there's snow in New York. It's not going to work outdoors today. It's not going to work indoors either. How badly does small business, how badly do local and state need this fiscal stimulus?
We desperately need it. I've been saying this for months. Governor Cuomo has been saying this for months. Governor Cuomo leads the National Governors Association, a bipartisan group. Every one of them, Republicans and Democrats, have been clamoring for help from Congress to give to state, local governments, but also direct relief for our small businesses in particular. I was in the city just yesterday, day before. The restaurants, I sat down with the restaurant owners. They are starving. They are literally starving. We have to help them. The federal government can right now help with the stimulus plan. It doesn't help the state and local governments, which is pathetic.
Okay.
It's an abdication of their responsibility, so we are in trouble, but at least get some money to the small businesses.
Right now, the reporting, including our Kevin Cirilli, is state and local aid won't be in this bill. I guess it's going to get done. You know the timeline as well. What is your and Governor Cuomo's timeline to where things fall apart if you don't get aid in this stimulus?
Right now, our expectations are that it's not going to be in there, is what we're being told, unless there's some holiday gift that's going to come our way, which we pray for. But if we manage our expectations and it doesn't come, what we're going to do is to be able to allocate $1.5 billion of state money to the essential services that otherwise would not be funded. You cannot have a plan to have a mass distribution of vaccinations throughout the state and at the same time cut healthcare workers from hospitals and clinics. It doesn't work. So we're planning on a Joe Biden presidency. We expect that we'll be able to get more help from the federal government. And I'll tell you, it all comes down to Georgia. It's amazing that the destiny of New York State is going to come down to who wins the election in the Senate races in the runoffs in Georgia in early January. If we can have a majority of Democrats, they understand this, they've lived this, they actually have empathy for people, they'll be able to get the job done. Short of that, we're going to have to deal with this in our budget in March, and we'll have to make serious cuts at that time. But right now, we're just not going to we're not going to lay off teachers. We're not going to lay off healthcare workers. We're not going to lay off police officers right now just because Washington is failing abjectly. So we're going to get it done in New York State. We'll be in financial trouble, but we'll have to deal with it in our budget in March.
All right, let's talk about what that means. You say major cuts. Does it also mean raising taxes?
That is absolutely on the table. The last thing we've wanted to do in New York State is to raise taxes, particularly in these troubled times. We understand that that is not a good plan B, plan A. It's not a good plan B. It's not a good plan C. But we may get to that point if we don't get that essential assistance from the federal government to help offset the $15 billion that we're now facing, the hole we're facing. We're going to need to do something. We don't want to have to do that. The federal government can alleviate that. Again, this is not because of how New York manages its finances. This is because of a global pandemic. This is not anything we had any control over. We're doing the very best we can. And when we get this vaccine out, I'm telling you, as sure as I'm standing here, New York State will be the very first state to be COVID-free because we're going to be very aggressive about this. That should be good news to businesses in New York to know that states across this country are not going to be where we are in a few months. We're going to be very aggressive about this. But it requires us to have money for healthcare workers to get that vaccine in people's arms.
So let's talk about the process of rolling out the vaccine. You said that New York State will be among the first. What is the timetable for the rollout as you see it now?
It's going on right now. We have different phases. We are in phase one, which is nursing home residents, staff, high-risk hospital workers. Those are literally out there being administered in hospitals all over the state of New York. And we're proud that New York State had the very first individual, one of our frontline workers in Queens, be the first in the nation. So we're excited about that. So we are also planning for phase two. Phase two will be essential workers and priority general public, meaning those with comorbidity, underlying health conditions. So we'll be focusing on them as well. So we don't think that's going to come until later January. But I'll tell you, if we can get more supplies, again, this would be a wonderful gift. If we can get more supplies when Moderna gets approved and Pfizer is able to come up with more, we will have no problem getting this out to New Yorkers. We have a very aggressive plan that we've been working on since last July to get this into communities all over the state, and in rural areas and in communities of color that have been hardest hit. We're going to have to overcome a lot of reluctance, and that's part of our public relations campaign that's going on as we speak.
Lieutenant Governor, we only have so much time, about 60 seconds left, but if you could tell me where we are just in terms of considering another lockdown. We've heard a lot about that in the last couple of weeks. What's your take at the moment?
We don't have to do that. There is a plan. If people right now change their behavior, those who've been ignoring the mask mandates and ignoring our request that they stay socially distanced, if they change their behavior, literally we can get through these holidays and we'll start seeing a decline. Right now, New York State is about 6% infection rate. That is still the fourth lowest in the nation, so I give a lot of credit to New Yorkers for adhering to this. But it's trending upward, and we're worried about hospitalization capacity. Right now, we're at about 25% for the state available, and if that starts getting much lower, then we have to talk about shutdowns. But that is not that is where we hope not to end up, and we're not going to talk about that right now because we don't know what the behavior of people will be over the holidays. So we can't control that. Individuals can control that, and we may not have to talk about any more shutdowns. That is the last thing we want to do here in the state of New York.